Hello, my name is Nurse Pauline RN. The goal of my channel is to assist nursing students to be successful in their fundamentals of nursing exam. I hope everyone is feeling good today. The topic of my video today is nutrition. I will tell you all you need to know for this exam in no particular order. In nutrition, always assess ability to swallow and chew in your patients. Assess the need for patients. Maybe they have dentures. Make sure the dentures are in while they are eating for chewing. Assess if patients need a swallow eval, if they are unable to swallow their meals, if they are unable to swallow their oral medications. A swallow eval is done by a speech therapist. Patients with pressure injury will need nutrition consult on admission. Post-op patients, they are always on an NPO diet, nothing by mouth. Their diets are advanced to clear liquid diets as ordered by the doctor. Examples of clear liquid diets are water, broth, gelatin, clear sodas. Example, ginger ale, if it's okay with the doctor. Some patients, like bariatric patients, may not be allowed ginger ale, so make sure you check with the doctor if your patient can have ginger ale. Patients who are post-op patients, if they have gelatin, make sure the gelatin is not of a red color. We need to assess our post-op patients for the presence of hemorrhaging. So if the gelatin is red, do not give it to the patients after post-op. When patients are NPO, it's okay for them to have oral care. It's okay for them to brush their teeth. They do not swallow the water. Always consider cultural and spiritual choices of your patients. Always assess personal choices of your patients. Jews do not have regular diet. They'll request a kosher diet. Asians do not accept ice. Asians do not accept ice water. On admission, assess patients who have dietary restrictions. Make sure they have their allergy bracelets on. Some patients are allergic to maybe peanuts. They usually have an anaphylactic reaction. Assess on admission if your patients are lactose intolerant. Some patients, like patients from African descent or patients from Asian descent, they do not do lactose. They are lactose intolerant. Patients with celiac diseases should have a gluten-free diet. Example of gluten-free is whole grains. When I did my Nclex, a quarter of my tests were on nutrition. I came out the exam laughing. I was so happy. Okay, patients with high blood pressure, they have a DASH diet. Example of a DASH diet: fruits, whole grains, low-fat nuts, beans. Patients with high blood pressure should have a low-sodium diet. They should avoid eating out of a can. They need low-sodium diet. Example of a full liquid diet: some patients from NPO, they go to clear liquids and the doctor will advance them to full liquid diet. Example of a full liquid diet is custard, sherbets. Or the doctor can order, there are some liquid protein supplements that the doctor can order for them. Clear liquid diets are transparent to light. They are clear liquids at room temperature. Example, gelatin. Patients with pressure injury, the doctor will order high calorie, vitamin B, vitamin C. The doctor will order proteins for patients with pressure injury. Patients with pressure injury will need, patients with pressure injury, or in general, patients who are malnourished, dehydrated, they'll need 2,000 fluids a day. Macronutrients are carbohydrates, fats, proteins. Fat-soluble vitamins are ADEK, that's your fat-soluble vitamins, ADEK. Water-soluble vitamins are B and C. Example of iron, green leafy vegetables, dark green leafy vegetables. Patients who are pregnant, they should have folic acid in their diet to prevent neural tube defects in infant. Folates are found in dark green leafy vegetables. The elderly, you find they have iron deficiency anemia. The doctor will order, if their H&H is low, they'll order blood transfusion for these patients, or they'll order iron oral or IV. Assess if your patients are Jehovah's Witness. If they refuse blood transfusion, iron or IV or oral, the doctor will order for these patients. Remember, patients with blood transfusion, you need a consent on the chart. Burn patient needs a lot of IV fluids. They need additional protein for repair. Some of these patients, if they're in the ICU, they may be on a TPN. Patients who are insulin dependent, they should carry around concentrated glucose with them when they are away from home. Patients with low glucose, the doctor may order dextrose 50 syringe for these patients. Monitor patients' glucose AC before meals and at bedside as ordered by the doctors. Fetal alcohol syndrome results from pregnant ladies who ingest or indulge in alcohol throughout their pregnancy. Alcoholics are usually deficient in thiamine, vitamin B. Sometimes they come into the hospital, you have to give them a banana bag, a bag with vitamins. Salmonella food poisoning is caused by people eating raw meat, raw poultry, raw seafoods. Foods that cause E. coli, example, pork. Calcium prevents osteoporosis in the elderly and pathological fractures. Calcium foods are dairy products, green vegetables. Calcium needs vitamin D for absorption. You have to take vitamin D with calcium. Lack of vitamin D in children causes rickets. So when the ladies are pregnant, we'll encourage them to take calcium. Vitamin D is also found in sunlight. When children have rickets, they have bone pain. Another disease is beriberi disease, lack of thiamine. occurs 2 to 6 months of age in children because their mom had inadequate thiamine intake during their pregnancy. Some of these mothers they also had a lot of alcohol during their pregnancy. Their diet was poor. When patient is on Coumadin, warfarin, we will teach them not to take vitamin K. Foods that are rich in vitamin K are spinach, broccoli, cabbage. Coumadin is a blood thinner, and vitamin K, which helps the blood to clot. So we'll advise them not to take foods that are rich in vitamin K. It's contraindicated. Patients with pernicious anemia will need lifelong vitamin B12 oral or injection. Examples of vitamin B12 food is meat, fish, eggs, and milk. That's our source of vitamin B12 or supplements. Enlarged thyroid is due to decreased iodine in the diet. Iodine is found in dairy products, example tuna fish. Iodine is found in seaweeds. If you're taking iron supplements, we need vitamin C for absorption. Vitamin C, for example, in the exam in Nclex, I saw where you would have like a green leafy vegetable along with orange, which is vitamin C. So when you go into MedSearch, please pay attention to your dietary restrictions. That's very important. Vitamin C prevents scurvy. That's a skin disease. Vitamin C is good for wound healing. Cranberry prevents UTI, urinary tract infections. Foods that are a good source of vitamin C is kiwi and strawberry. Vitamin A prevents night blindness. Beta-carotene are the yellow foods like carrots and sweet potato. Beta-carotene in the body is converted to vitamin A in the body. Vitamin A, another name is retinol. Retinol is good for eye health. Prevents night blindness. That's for vitamin A. First class proteins are complete proteins. Complete proteins sources are from animal source. Meat, fish, dairy, eggs, bean, peas. Anorexia patients, they have eating disorder in which they starve themselves. Bulimic patients, they binge eating. When you have a bulimic patient, monitor them 2 hours. Monitor them for 2 hours because they go on the side and binge, induce self-vomiting. Patients on Lasix, monitor their potassium levels. Patients who's having a lot of diarrhea, like C. diff patients, monitor their potassium levels, and the doctors will order you to replace these potassium IVs or orals. Patients post-op patients with surgical wounds, especially those patients with abdominal wounds with abdominal drains, monitor their potassium levels. You'll find you'll be giving them quite a bit of potassium IVs. Since they are NPO, they're not able to take oral after surgery. Patients with stomach ulcers, avoid caffeine, spicy foods, aspirin, NSAIDs. Patients with stomach ulcers should do small, frequent meals. Patients on TPN NG tube, G tube, gastrostomy tube, the head of bed should be elevated 30 to 45 degrees, prevents aspiration precaution. Confirmation of placement of gastrostomy tube. You'll insert air in the stomach. You'll hear a rumbling or a bubbling sound. This confirms that the tube is in the right place. You confirm placement. If placement is not confirmed, consult your doctor. Do not feed this patient. Patients on tube feeding or NG tube, G tubes, they will be NPO. Follow your doctor's instructions, please. Indication for tube feeding, TPN, total parental nutrition, patients with malnutrition, difficulty swallowing. Patients with difficulty swallowing, evaluation is done by a speech therapist. Patients for TPN, total parental nutrition, are for patients who are critically ill. Also, these patients may be in the ICU. Example, maybe your burn patients. To confirm NG tube placement is done by chest x-ray. Signs and symptoms of tube feeding intolerance is abdominal pain, distension, vomiting, diarrhea. Check your residual every 4 hours as instructed by the doctor. If the flush your G tubes with water as ordered by the doctor. If patient is not tolerating their tube feeding, decrease the tube feeding, or you will communicate with the doctor. Check for residuals. If they're not tolerating, check with your doctors. Patients with NG tube, they need oral hygiene and they need lubricants applied to their lips and nostrils. They will be NPO. Patients with low albumin level, doctors may order protein for them, dietary protein supplements. Some patients may go, if they're NPO, we'll have to tube feed them. Some patients, low albumin to malnutrition, they'll have TPN, total parental nutrition, TPN for malnutrition. Please hit the like button, please hit the subscribe button, and please share my video. Thank you. Have a blessed day. I hope you're doing well with your exams. Take care.